You may have heard that LASIK or other eye surgeries can cause dry eye. Actually, dry eyes refers to a specific condition where the tear film is inadequate. This is usually due to malfunctioning glands that produce some of the components of the tear film. The disruption to the glands doesn't happen after LASIK. What LASIK and other eye surgeries can cause is STODS. STODS is an acronym that stands for Surgical Temporary Ocular Discomfort Syndrome. STODS is a temporary condition that resolves as the eye heals after surgery. This takes anywhere between 2 weeks and a few months. Once the eyes have fully healed, the tear film goes back to where it was before surgery. The leading two causes of dry eyes in young people are contact lenses and inflammation from allergies. In these people, LASIK often actually improves dry eye symptoms and is an effective way to remedy the irritation in dry eyes by contact lens failures. The surface of the eye is the most sensitive part of the human body, with over 7,000 nerve endings in an area about the size of a dime. This sensitivity helps the eye respond quickly to dryness by producing new tears. The irritation stimulates a collection of glands in the eyelid to increase tear production. Tears aren't only important for comfort, they're also very important for vision. Tears coat the cornea and keep the surface regular. This is similar to keeping a camera lens clean. A camera lens with an irregular surface will produce a worse image than a camera with a smooth lens. The tear film is so important that your surgeon may talk to you in great detail about how to optimize it before surgery. A good tear film improves the accuracy of measurements and speeds healing after surgery, thus minimizing STODS. Let's talk about what exactly causes STODS. Eye surgeries generally involve making very small incisions in the cornea, usually with a laser. These incisions cut through some of the nerves in the cornea, which in turn disrupts the feedback loop with the glands that produce tears. The decreased tear production results in discomfort. Over time, these nerves do grow back, equilibrium is restored, and symptoms subside. STODS varies with different types of eye surgery. PRK causes the most extreme STODS because it removes tissue from the surface of the eye. While drops and bandage contact lenses can minimize discomfort after PRK, full comfort doesn't return until the surface is healed, which usually takes between 3 and 7 days. LASIK, on the other hand, removes tissue to reshape the eye under a flap, which spares the surface. However, creating the flap does cut through nerves, which can take between 2 weeks and a few months to fully regenerate. Cataract surgery, ICLs, and LALEX involve very small incisions, which cut through only a fraction of the nerves compared to PRK, so STODS is much less likely or severe. This chart shows the nerves that are affected by each procedure and how they recover. STODS symptoms are expected to resolve by around 3 months, but may vary depending on several factors, the most important of which is how healthy the tear film is prior to surgery. Some people may never experience STODS at all. For example, I had ICLs, and after the first hour, I never experienced any irritation. Thankfully, there's a lot we can do both before and after surgery to mitigate the symptoms of STODS. Before surgery, a simple and effective therapy is actually a lifestyle change. Avoid overhead fans, be aware of vents, and generally prevent air from blowing in your face to stop the tear film from drying out. Your surgeon may recommend other measures such as artificial tears or so many other options that may help stabilize the tear film and optimize the ocular surface. There are far too many options to discuss here, but it's important to talk with your doctor about which may be best for you. After surgery, you may be on some eye drops, and some may have preservatives. Preservatives and eye drops can cause irritation, so use preservative-free artificial tears to relieve symptoms. Also, remember to wait 5 minutes between any eye drops in the same eye. There are even many options to manage the rare case of persistent STODS after surgery, and your doctor can help develop a plan that's right for you. So, in summary, saying that refractive procedures such as LASIK cause dry eye is not accurate. However, any eye surgery can cause STODS, which is a temporary ocular discomfort and a normal part of the healing process. Luckily, your doctor can work with you to minimize or prevent STODS entirely. Seek out an RSA surgeon for expert advice.